I take care of patients with problems involving the shoulder, elbow, and knee. Anybody who's had anything from a traumatic injury to maybe a degenerative condition, and we treat them with all sorts of different modalities, including physical therapy or oral medications, all the way up to injections and then, when necessary, surgery. Many of those treatment options have been developed by physicians who are right here at Rush, working in our research labs or in our clinics or in our operating rooms to try to improve the techniques that we're offering to patients to see a successful outcome. What we've really focused on is how do we get patients better, how do we get them there quicker, and how do we improve their functional level ultimately? Because that's at the end of the day what patients are looking for from us, is to try to restore their level of function, whether that's they want to go out and train for a triathlon or they simply want to be able to go to work or get up and make breakfast for their kids without having pain. For me to see somebody who comes in who has a love of whatever it may be, whether it's hockey or running or soccer or basketball, they sustain an injury and for whatever period of time they're taken away from that activity. For us to have the ability to directly impact their life, either with a non-surgical or surgical treatment, and ultimately return them to that activity that they love, that's the tangible aspect of what we do that really makes it so satisfying, is to be able to have a direct impact on somebody's quality of life, to give them back something that they've lost.